Good evening to everyone present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Vijay Varat. Sir is MBBS, MD consultant, allergist, pediatric pulmonologist, clinical immunologist, and consultant at Sai Allergy Asthma Eye Hospital. With the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is pregnancy and the allergic dilemma, a guide to safe symptom management. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, sir.
Yes. Thanks IGCP for providing the platform, and thanks to the viewers for the very interesting topic. Like since last 25 years, when I'm practicing in allergy, I have seen that during the pregnancy, it's the most difficult time where most of the gynecologists, also the practitioners, are confused. Like, is the medications will be harmful to the baby, and how to go ahead, and how should be the approach. But frankly speaking, it's very safe. Some of the medications are very easy to give to the pregnant mothers, and as well as if we are prepared, like even I will say it before the pregnancy, if the mother's history is taken properly since childhood, any hidden signs of allergy and all, as a practitioners, we should always look towards allergy as a chronic disease like diabetes, blood pressure, and cancer also. And its progression is very severe now. During the pregnancy, 30% of the women get a very significant asthma or urticaria and angioedema trigger. And then it becomes very difficult to manage these things, the stress because of that. So as a practitioners, we all should know that these hidden signs also before the pregnancy, if you can pick it up in the patients with the denim organ folds, there's watering of eyes or rubbing nose and eyes, and open mouth breathing into the any childhood history of that, then the significant sensitization, barrier line, a lot of women's young adult, like a lot of the girls, they go on doing this way facial grimaces or pushing the nose and this turbinate and posterior pharyngeal hyperplasia. So these signs as a practitioners, maybe we are a gynecologist or practitioners, we should always keep in the mind these long eyelashes, the Muller's muscle spasm, barrier line. We can pick it up with these patients before the pregnancy. And if you can guide them, like during the pregnancy, you may have a trigger for the rhinitis, sinusitis, or the urticaria, angioedema, or food allergies and all, or even the some of the patients' systemic reactions like anaphylaxis or asthma attacks and all. We can treat them much better before the things. And whatever the immunologic changes happen, there is an imbalance of that, and that's why many of the women, even the autoimmune significant symptoms also getting triggered because of that. So if you see the immunological changes in these patients, so the regulatory factors which control the inflammation are these. And while some of the women, like 30%, they get a trigger for the inflammatory factors, and then they have a trigger because of that. So we did a study in Pune also, around 20 patients of asthma. We found these specific like interleukins and these factors were responsible TH2 inflammation. And during the pregnancy, it has a different impact on the these allergic diseases. And these T regulatory cells get disturbed and then they have a problem. So in the third trimester, towards the more inflammatory and type 1 immune state happens in the context of labor and delivery. That's why nowadays, even there are allergy prevention programs, the studies are happening that during the third trimester, if the mother is supplemented with some specific research probiotics, it will definitely prevent to the mother also as well as to the baby. And then extensive exchange of factors between the mother and child, they have also impact on that. So again, the asthma severity, you can see one third of the patient will have the same symptoms. One third will get triggered. 30% is very significant considering India's population and so many mothers are pregnant. You can see the 30% is very significant asthma, which will have. So even nowadays there is no need of spirometry, even exhale nitric oxide levels and the oscillometry. There is no need to blow far, very severe. Mild blowing also can pick it up these patients of a refractory cough and asthma, where the inflammation can be picked up and they can be guided with the safe inhaler therapies and it will help to them. Even the postnasal dribbling or upper airway cough also it has a lot of impact in many of these mothers, and so they can be treated very safely with the postnasal dribbling to reduce like Montolica's fexofenadine, the nasal spray, the nasal wash. It helps a lot, and these are the some medications they can be given uh, or they are given into the India, but these have a lot of side effects for generation. So rather than second generation like fexofenadine and all, they are much better. And after the XL nitric oxide levels, and if you can reduce the asthma exacerbations properly, then it will have a very good impact on the mother psychologically also, as well as it will reduce the exacerbations and the pressure on the uterus, and because of that, the blood pressure and all will also be controlled properly if we manage these asthma exacerbations safely. And even during that, the mother can be having some precautions like if any pre-existing conditions or severe asthma or smoking and obesity, they should also be managed with the safe foods, habits. Then some breathing exercises also they can be done during the pregnancy, as well as some simple precautions like indoor pollutants and outdoor pollutants using a mask or air conditioners. They can be properly cleaned. The pollen filters also can be utilized into that. Then HEPA filter vacuum cleaning into the beds, into the sofas, curtains, into the deep pockets of kitchen, as well as into the cars also. They can also be utilized. So there are some task forces where during the pregnancy, many of the mothers, I am seeing a lot now uprise into these atopic dermatitis, urticaria, pregnant ladies, and emollient use is very important. Some of the very refractory cases, then ultraviolet rays, but may have an impact on the fetus. So we don't recommend that. But topical treatments with the proper significant emollients, they help a lot. Ample amount it should be used. Some specific very mild cleansing body wash with moisturizer, they can also be used. Then during the rhinitis and all, the nasal steroids, they are very helpful. They are very specific and without any side effects. Whenever the steroid name comes, the people get worried, but it is not that way. The nasal steroids are very safe. They can be given for a longer period also, and even effects of the anaphylaxis on the fetal oxygenation. Potentially, it devastates the fetal oxygenation, and it can be really threatening to the baby also as well as the mother. So, depending on that, if you give the antihistaminics like fexofenadine in a higher dose, and even before the pregnancy, like two, three cases are with me where before the pregnancy, the mother was given a omalizumab like biologics and all. It was very useful to the mother to prevent these severe reactions and anaphylaxis. And then, if it is suppose there is an anaphylaxis, then positioning on the left side to avoid compression of the aortocaval vessels of the gravid uterus, maintaining adequate uteroplacental perfusion by keeping the systolic blood pressure more than 90 millimeter of mercury, and monitoring the fetal heart rate and status while applying treatment to the mother. Then, if there is a food triggered anaphylaxis, now there is CRD, component result diagnosis, then we can do the safe standardized skin prick test. Within 40 minutes, the report is done, and we can show them is it a food allergy, it is an intolerance. Food allergy within 2 to 3 hours, it has to be. Most of the patients have an intolerance and they feel it is a food allergy. So the intolerance is after 6 to 8 hours or next day if they have an ample amount. So there is no need to stop for throughout the pregnancy. After a few days, we can develop a tolerance. Then during the anti-allergic treatments, even some first generation antihistaminic will have an impact to the baby. So rather than that, this fexofenadine and all, they don't cross the blood-brain barrier and they don't have that. So it's a second generation one can be utilized very well. Even nowadays, allergen immunotherapy has been very safe. People don't know about that. These allergy vaccines are safe during the pregnancy also. So once we suspect a mother which is going to be pregnant, and we identify the specific dust mites, pollens, and all. We do the standardized skin test and we desensitize against the dust mites, pollens, insect droppings, dried feathers, and all. And then environmental control measures like using a HEPA filter, vacuum cleaning, then allergen-proof covers to the mattresses, pillows, cleaning with the proper vacuums, then minimizing the outdoor activities or even the passive smoking is very common. Like somebody, grandparents and the parents and all, they go on smoking. So they should be guided not to smoke inside, outside. Then proper antioxidant-rich foods, the vitamin D, then they can also be given. And some of the patients who they have cross reactivity of the shellfish with the dust mites, then some of the patients grass pollens with the fruits and all. If we identify that and oral food allergy syndrome is there, we can guide them that and then can develop a tolerance and they can have the healthy food for the baby also. It is very important. Then, as I mentioned, some of the biologics, the approved biologics are like omalizumab, benralizumab, brolizumab, and even the dupilumab. The studies are done accordingly. Azathioprine and all, if before the pregnancy they are given, they can also be continued during that, but they have definitely some side effects about this. And then potential complications, if asthma if it is not properly managed, then the preterm baby labors, delivery problems, high blood pressure, low birth weight babies are born. So it should be managed before the pregnancy, during the pregnancy, and continued properly. So you track the things. Emergency action plan should be in if suspected anaphylaxis, then our own zero point 0.5 ml adrenaline can be kept ready always in a 2 cc syringe. In a spectacle case, it should not be open to the sun, otherwise it can be carried for a year. EpiPen it is not available in India, but we can make our own. Considering the allergy as a systemic disorder, and even it has a multiple inflammatory symptoms leading to the gastritis, to the irritable bowel syndrome, constipation, and then leading to the further. And this understanding this TH2 inflammation, which continues from one part to another, even the congestion, rubbing of eyes, angioedema, this is very common, and a lot of mothers then later on they have problems. So this link we should identify one mucosa, one disease, and one airway, one disease, and we should manage that properly. So during the pregnancy, also the same way, we have to take it seriously with the nasal steroids, nasal wash, some steam and all if it is required, not excessive ones. Then the safer antihistaminic also they can be very well used. Then inhaler therapies also depending on the low salbutamol or if it required the budesonide and all they also can be controlled. Even probiotics are very safe. They have been found that they alter the things at T cell receptors and protoglycan and they have a specific action on the IgA production. So you can see how the action happens over here and it reduces the inflammatory markers and it reduces the infections and the inflammation is also controlled and how long term wise. And first is that the allergen avoidance. So depending on the patients, if you can do the test actually, it's very easy. Within 40 minutes the report are available. We can guide the patient properly about how the dust mites are there, pollens and all. They can take some simple precautions and then we can prevent the overuse medications in these patients and it will have a very good impact. So even the Indian College of Allergist Immunology guidelines, they have said that after the proper analysis of the allergy point of view history and specific IgE testing and avoidance measures, like you can see like dust mites, pollens, cockroaches, animals, molds, they're very common. 92% of the patients have that. And so we can pick it up early and the skin prick test, why it is helpful? Because it picks up the mast cell bound IgE. And during the pregnancy also we can do it. It's very safe. I have done thousands of pregnant ladies the allergy test and it is very safe. So even now we are having a 1 millimeter lancet penless. Now this CRD machine also we are having 60 lakhs machine where exactly we can identify is it anaphylaxis, it is just urticaria angioedema, and we can differentiate the different type of RH1, 2, 3 proteins or soy also gliam 5, 6, 8. They are storage proteins. So depending on that, different this cross reactivity of the allergen sensitization, which can be detected, and we can really guide the patients about the specific proteins and the overuse anti-allergics or medications also can be stopped depending on the latex sensitivity. If there is a cross reactivity, these patients after eating banana and all, they have a problem. But the sensitivity is to the latex. So we guide the patients and we control the inflammation. And the patient mother also can have fruits and vegetables so that it is nutritious to the baby and it is helpful. And the cross reactivity of the cockroach with the prawns, tropomyosin. So insects and all, depending on the risk of anaphylaxis, we can guide to the patients. So even eggs and all. So if it is really a epitope which causes anaphylaxis, we can guide them and which can be really helpful. So even the allergen immunotherapy has been very well established by worldwide and it can be given during the pregnancy also. So it is useful to the mother also and it prevents the severity of the allergy to the next generation. So as a gynecologist and as a practitioners, our role is that not only the mother, even the child, because we are having so many sonographies and all to prevent any chromosomal disorder, genetic disorder. But already the proven allergy, it has been found that the mother is having allergy. There are more than 66% to 85% chances that baby will have a severe allergies in the childhood, like childhood asthma, anaphylaxis, and all. If the mother is treated properly with the allergen immunotherapy, even this will work for the baby to reduce the symptoms, to reduce the severity and the complications. So this allergen immunotherapy has been very well in allergic rhinoconjunctivitis, asthma, sting insects, significant atopic dermatitis with the dust mite sensitivity. Nowadays, we have a very good allergen immunotherapy. We can expect the reduction into the symptoms, reduction of the medicines, side effects of the medication also can be prevented. And with the proper, we can have a food immunotherapy also. And these are the targeted therapies like interleukins and all against the interleukins. Like we are having a biologics, we did a study and we found these GH2 inflammation interleukins into these patients, and it is already since thousands of years these studies are done. Considering this allergic march leading to the baby also having a problem, we can treat it much better in an early stage with the proper moisturizers. Even if the baby is immediately born, very mild cleansing lotion should be used, cleansing body wash, and very good research-based moisturizers can be given to the baby. And if there is a significant family history of atopic diseases, even the baby may not be need to have a daily bath. It can be weighed. Even the vernix caseosa should be kept for a long period, and it has a protective effect. So these are the guidelines are changed, and which can really help the baby not to have a early eczema, asthma, rhinosinusitis, tonsils, adenoids, throat problems, or even seborrheic dermatitis to food allergies, GRD, allergic rhinoconjunctivitis is very significant. So even the with the World Allergy Organization 2019 to 2023, I was involved into this allergy prevention committee from Pune. Our hospital was also involved in amongst the 7 hospitals worldwide. And we did a publication in 2023 World Allergy Organization journal that how our role is there. And as the baby into the womb and again after birth is exposed to these indoor outdoor pollutants and allergens and all, the COPD, which is increasing a lot now because of the if in an early stage, if the baby is exposed to these things, and if there is a significant family history, if the mother is not managed, there are more chances of chronic respiratory diseases into these children next, which is a second death causing. So, while using the medications to the better, the nasal sprays, inhalers, second generation antihistaminic moisturizers, specific soaps, precautions, they are very useful. They can be very well. Then inhaled corticosteroids like nasal steroids like fluticasone, budesonide, beclomethasone can be given very well. Short-acting beta-2 agonists like salbutamol and all. Then salbutamol, formoterol combinations also can be given there. Then long-acting LABAs along with the ICS, depending on the expert's advice only, it should be given. Then safer medications like antihistamines, the first generation I will not advise. Then loratadine can be given, benzophenadine, they are very safe. Fluticasone, triamcinolone, this is even propionate, furoate, or mometazone nasal sprays are also very good. So allergic march should be considered during while managing the pregnant woman also, and before the pregnancy. I will say कि adolescent girls and boys, if they are examined carefully and they are going to be parents. So suppose somebody comes for the treatment of the for the pregnancy or they are planning for a pregnancy, if they come to us, we should guide them about these hidden signs. We should check as a doctors and we can guide them. And at the primary, secondary, and tertiary levels, from the diet, the antioxidants, even the early stage allergy testing, desensitization, biologics use, probiotics use, we can alter these diseases and the complications. And if the parents are treated properly, even the family members and the next generation also will have a benefit. And very safe medications like a very good amount of moisturizers, some Ayurvedic cough syrups, even some of the reduce the postnasal dribbling inflammation, the nasal steroids and fexofenadine, and avoidance measures like depending on the exposure, the dust mites, pollens, indoor outdoor pollutants, we can guide the patient passive smoking, tobacco smoking, then along with comorbid diseases like obesity, then consumption of any of the other things, we can guide the parents and we can have a very good pregnancy during that, and as well as to the long term wise, the baby also should have a protection on that. So Every pregnancy is unique, so that works on one person may not work for the another. Always prioritize the guidance of your healthcare providers, seek their advice before starting and changing any allergy management strategies during the pregnancy. So we should be combined and we should have uniformity so that we can guide the parents accordingly. And it can be really useful to the community also. So the concept should be that there are no all contract. I mean, I have seen like many of the patients are also scared, and the doctors also say "Ki the patient will not tolerate anything." It is not that way. When the sensitivity level is very high, mast cell sensitivity, we can reduce it very very safe anti-inflammatory like fexofenadine and all. Then with some precautions and all. Once the gut mast cell sensitivity as well as the contact allergens and the inhalation allergens, the sensitivity level goes down. The patient can be exposed to these things, and even we can avoid the sensitivity pattern and we can reduce the inflammation, which will help to have a lesser medications and complications of the medicines as well as the complications of the disease. So we have to be prepared, and if we have a uniformity and if we can guide the patients about the simple precautions and all, they will be really useful. So thank you, thanks a lot. If any questions, we'll go ahead.
Thank you so much, sir, for this wonderful presentation. We do have some question if you like to take that up.
Yeah.
So the first question is, how does the immune system adaptation during pregnancy affect the likelihood of allergic condition?
Yes. See, basically, allergy is a hypersensitivity disease. There is a lot of misconception into the community that they feel that during the pregnancy the immunity goes down, and that's why the people have a problem. It is not that way. It is a dysregulation of the immune system, basically. And some of the women, not all the women, 30% of the women have a trigger for the this dysregulation or hypersensitivity. So we have to be very specific that because of this hypersensitivity, the mast cell get triggered and they'll get inflammation or the nasal sensitization which increases, and that causes this trigger. So this is a immunological response or hyperimmune response. It is not a lower immunity. So we have to be specific while treating these patients. By increasing the immunity, it is not going to stop the progress of the disease. Rather than that, reducing the sensitivity and giving a specific targeted therapies definitely it will help the patients.
Thank you, sir. There's one last question. Are there any links between maternal allergies and fraternal outcomes, such as preterm birth or low birth weight?
Yes, definitely. If it has been found that most of the 30% of the mothers will have significant asthma exacerbations and all, and if their airways are getting compromised, definitely it has been found that the babies will be born preterm or early age, low birth weight and all. And if because of the severe asthma, the blood pressure also increases, and this hypertension also causes the problem for the fetal placental circulation. So, and even the side effect of the medications, because in India, over the counter medications are so much consumed, and so many oral and parenteral steroids are also given during the pregnancy, also, not only in urban but the rural areas and all. And it has been found that that also affects the fetus. So, considering all these things, definitely in allergy and asthma, these causes a, I mean, definitely it affects the fetus.
Thank you so much, sir, for answering all our questions. That's all from our audience. So, sir, before concluding, any take-home message from your end?
See, pregnancy also, whatever the cough, cold, allergic, asthma, these cases are increasing. We have seen a lot of cases now post-COVID having a refractory cough into the mothers. The Th2 inflammation is there, asthma which is not getting controlled. Many of the mothers are having a significant urticaria angioedema, as well as they are having a severe drug allergies, and then they get confused. They unnecessarily postpone the pregnancies. It is not that way now. Very safe, targeted therapies have come. We can do the standardized skin or the component or diagnosis test. We can prepare the mothers, and they can conceive also. They can continue the pregnancy. And this allergen immunotherapy, which is a disease modifying therapy, which can not only help the mother, even to the babies also, the next born babies. So now the advancement into the allergy immunology has increased, and the mothers also can be treated very well during the pregnancy about these things without any side effects also.
Thank you so much, sir, for joining us today. With your permission, I would like to conclude today's session. Thank you.
Thank you.